Hello everyone, you're watching sqadia.com. So, if a patient presents to you with osteonecrosis, how would you start the treatment? Straight away put him on some kind of splints or make him go for bed rest? Or would you straight away go for surgery? Isn't it that's important that you have to understand that at what stage the osteonecrosis is? Depending upon the stage, that would define the kind of a treatment that patient needs. So in this section, we're going through what is the early osteonecrosis, what are the signs and symptoms of early osteonecrosis, what is intermediate, and what is the late necrosis. And then we will be going through the different classification systems. For example, Ficart and Arlet, we will be going through the Steinberg classification, we will go to the Arco's classification. That's why, because most commonly used is Ficart, and that actually dictates the kind of a treatment the patient needs. Usually Ficart classification is used for the depending upon the kind of a treatment patient is going to have, and if it's early in, for example, grade 0 or 1, then maybe a conservative treatment. But if the patient presents with stage 3 4, then probably surgical treatment would be better for the patient. So coming to the stages of disease, Ficart and Arlet were the first one to actually define osteonecrosis of the hip, and it was basically in 1980 they did it. In 1980, Ficart and Arlet introduced the concept of radiographic staging for osteonecrosis of the hip. They divided it into 5 stages, but it starts from stage 0 to stage 4. Stage 0 is actually silent hip and normal radiograph. The point over here is sometimes the process in case of non-traumatic osteonecrosis, the process has already started. For example, the patient has a Gaucher's disease, then he cannot have a normal marrow. Definitely there is some degree of osteonecrosis, but bone probably that would not be symptomatic. That X-ray is normal, MRI would be normal, patient has no symptoms. That is the kind of a stage, and it's called as stage 0, that the hip is silent, there's no symptoms. The radiography is normal, MRI, bone scan would be probably normal. In case of stage 1, according to the Ficart, is that the normal or minor changes. This is actually usually at a stage with a subtle loss of clarity, a blurring of trabecular pattern, a slightly patchy osteoporosis is seen. Usually X-ray can still be normal, but if you go for an MRI, probably there would be definitely some degree of edema. There would be some changes around the joint at that stage. But at this stage, the hip is not silent. That means the patient usually complains of some degree of pain at this point. So now if it's 2A, according to the Ficart, is where there is a diffuse or localized osteoporosis. And the important thing to remember is, although this is radiographic staging, but we have to remember probably that the clinical presentation would get severe as this radiographic severity increases. At 2A, there is diffused localized osteoporosis. There would be definitely sclerosing, a cyst formation of the femoral head. And at 2B, there would be the crescent subchondral line, which is I've been talking in the previous section as well. Because once the subchondral fracture of fissure occur, this results in a crescent formation, a crescent sign. Now that is important because at this stage, this means that the subchondral fracture has actually occurred. Now, from the stage 3 is actually sequestrum, breakage in articular cartilage from one end affected area to the other, and normal or increased joint space. That is from sequestration, and then fragmentation is actually, this is the stage. Once this is actually occurred, now that there is advanced arthritic changes is termed as stage 4, in which there is actually a decreased joint space, collapse of femoral head, eventually it will be collapse leading to acetabular osteoarthritic changes. So if in simple words, remember stage 0 is silent hip, stage 1 is symptomatic but normal X-ray, stage 2 is actually there is increased osteoporosis, sclerosis, stage 2A and stage 2B is crescent sign with gradually increasing severity of painful hip, and then stage 3 is fragmentation, and stage 4 is collapse of the head and advanced arthritic changes. Now, Steinberg modified Ficart classification, but the most commonly used classification still clinically it is Ficart, as it is very easy to remember and very easy to actually apply. But Steinberg slightly modified Ficart classification. Stage 0 was normal or non-diagnostic radiograph. MRI may be normal, but bone scan may or may not be normal. Usually, bone scan shows a cold lesion. Stage 1 is a normal radiograph, abnormal bone scan, and MRI. The changes would only be visible on MRI. X-ray would still be normal. Stage 2 is abnormal radiograph showing cystic or sclerotic changes, which was actually 2A, 2B was according to FICARD it was 2A, but according to the Steinberg it's only 2. And subchondral collapse, which is actually producing crescent sign, has gone into 3. Instead of having dividing stage 2 into 2A, 2B, it has actually gone into 3. Now, stage 4 was flattening of femoral head. That is where the FICARD staging ending. But it has actually progressed further into stage 5 is joint narrowing with or without acetabular involvement, and 6 is advanced degenerative changes. So actually it's slightly modification of FICARD, but the main thing is that initially it's no radiographic sign, then there is sclerosis, then there is subchondral fracture and collapse leading to crescent sign, eventually leading to fragmentation, and eventually collapse of the head. So that is what needs to be remembered, that this is how the severity progresses. Now then later on, Arco's staging was devised. This is actually stage 0 is patient may be asymptomatic and all clinical investigation normal. Biopsy probably done at this arthroscopically would show osteonecrosis. Stage 1 in X-rays are normal, MRI or radionuclide shows osteonecrosis. Stage 2 is X-ray or MRI show early signs of osteonecrosis but no distortion of bone shape or subchondral crescent sign. Subclassification is A is less than 50%, that is very small amount of bone is involved. If it is 50 to 30%, that's type B, and more than 30% bone is involved is type C. Similarly, if you see stage 3, it's the crescent signs appear. In stage 4, there's signs of flattening or collapse of the femoral head. And stage 5 is changes as above plus loss of joint space. And stage 6 is changes of this loss of joint space. There is secondary osteoarthritis with marked destruction of articular surfaces. It's almost similar. There is slight modification of all these three. That is why FICARD is actually still used as the primary classification of choice in case of AVN of the hip. Coming to the treatment, how do we, depending upon this step, we actually classify osteonecrosis into three different categories. That is early osteonecrosis, intermediate osteonecrosis, and late osteonecrosis. Now, if you see this over here, early osteonecrosis, while the bone counter is intact, there remains the hope that the structural failure can be prevented. Now, early osteonecrosis actually means that there is definitely insult, but now yet the sclerosis has not appeared or osteoporosis is not marked. The bone or X-ray may be showing very much normal, and structurally the bone is still intact. All the osteoblastic cells and osteoclastic cells and bone cells have actually died, but structurally the bone is intact. Some lesions heal spontaneously with minimal deformity, usually in non-weight bearing area. For example, in case of superior medial osteonecrosis, if this occurs, this is not a weight bearing area. So if the patient just advised bed rest for 2 to 4 weeks, usually by end of 4 weeks, this would probably heal on itself and not much needs to be done. Examples include superior medial part of the femoral head, non-weight bearing surface of the femoral condyles, and talus. Now, if it has progressed to sclerosis has appeared, this means the bone is dead. There is actually definitely bone mineralization is going on, and that is if this is the stage has reached. If the bone counter is still intact, and unloading osteotomy will help to preserve the anatomy while remodeling proceeds. Now, this is important that if the necrosis has actually progressed to a certain degree, but bone has actually not collapsed, the head has not collapsed, this would mean that structurally bone is intact. If we somehow unload the area which is actually under the load of the body weight, that is by using a derotational osteotomy. That is, if the head is in this position, this superior lateral aspects are deloaded by rotating the head around it, forming by a subtrochanteric osteotomy. As a result, this deloading would mean that superior lateral part has now the superior medial part, the superior medial part is now the superior lateral part. What that would happen is that the weight would be going through that superior medial part, which is now being rotated, and superior lateral part would be non-weight bearing area. Cerebral with the rest and with time it can actually heal on itself. Medullary decompression and bone grafting may have placed in Arco stage 1 or 2 osteonecrosis of femoral head. Now, as we know that it's actually cartilage and capsule is a closed structure. So the pathology, and when we're discussing the pathogenesis, once the arterial occlusion occurs, the problem is why this arterial occlusion has occurred. It's a closed compartment, and there actually starts out a vicious cycle. So decompression would actually relieve this problem, that it will no more be a closed compartment, and compartment syndrome and due to increased intra-compartmental pressure, but the scale were occurring will not actually happen. Now coming to the intermediate necrosis. Now once there is a structural damage and distortion of the arterial surface, conservative options are inappropriate. For example, a fragmentation has occurred. Now fragmentation means the bone is not structurally intact. Now whether there is head has deformed or not, no, that's another point, but that means structurally the femur head is not normal. Joint may still be salvageable. In this situation, realignment osteotomy either alone or combined with curettage and bone grafting of necrotic segment. For example, sometimes although the fragmentation is there, but it's on a very small area. So what we can do is we can take out the necrosed bone and derotate the head so that the normal bone is actually under the stress of the body weight bearing. Therefore, that area which we have actually taken out as a dead bone can heal on its own later on. In case of late osteonecrosis means now the bone has fragmented and head has collapsed. That's actually the joint is deformed. When the joint becomes deformed, the options are either the replacements, which is usually done in case of hip and knee, or it's the orthodesis. That is, you just fuse the joint so that the pain goes away in case of wrist and ankle. Destruction of the articular surface may give rise to pain and severe loss of function. Orthodesis of a joint is an option. For example, in case of ankle or wrist, partial total joint replacement is the preferred option for shoulder, hip, and knee. Now, this is actually, if you see it over here, this is showing advanced stage. Now, the head has actually fragmented and collapsed and showing advanced, even some degree of sclerosis is possible here as well. So this is definitely stage 4 Ficart, or probably Steinberg stage 5 or 6, in which actually the joint space is reduced and there is some degree of acetabular arthritis as well. This has been replaced by total hip replacement. So in this we have gone through the different classification systems, which include Ficart, Arcos, and Steinberg. But the important thing is that actually it's a radiographic evaluation based on 3-4 processes. That initially it's usually this silent radiograph, there is no radiographic changes, but actually the osteonecrosis has started or the cells have actually already died, but bone is structurally intact. Then there's this next stage which includes the sclerosis and mild osteoporotic areas, which results in a cyst formation in this area, neck, in the metaphysis. Now once from this it progresses to subcontinental fracture or fissuring leading to crescent sign. Then eventually the next stage is actually fragmentation. From fragmentation eventually leads to collapse of the head. Once the collapse of the head has actually occurred, then there's further progress to reduced joint space and acetabular changes. Now, as the severity increases, the non-surgical options become limited. So eventually we have to move for the surgery. Thank you very much. Keep watching sqadia.com.